Welcome, ladies and gentlemen. Today we're going to do nasal gastric tube insertion. So first of all, we're supposed to know some of the things that you requirement are supposed to be here. Yeah, before I do anything, first of all, it's the strapping, and also we're supposed to have KY jelly for lubrication, and also we're supposed to have nasal gastric tube itself. And also it's supposed to have a syringe, which is a 10 ml syringe for just to aspirate if we are indeed in stomach. Not only that, you're supposed to have also a orange stick, just to clean up the nose before we insert the nasal gastric tube, and also the examination gloves. That is it. So what's going to happen as usual, first of all, you introduce the 7 basic procedure, or let me say the 7 basic of which and every procedure. First of all, you wash your hands, as usual. You go to the patient. Good afternoon, Mr. Msonda. This is student 28. I've been assigned to do nasal gastric tube insertion, or to insert a tube that can help you to feed. Permission to go ahead. And is there anything that I can do for you within the hospital premises? And are you comfortable where you are? Okay, great. Okay, speak for privacy. I'll be back shortly. Let me just prepare my trolley. You come here again, you do the same thing. You insert yourself. As usual, you prepare the stripes. Most in the exam setup are going to find that prepared for you. And probably you're supposed to have for a title, of which you should try to measure the length of the nasal gastric tube. But in this case, I'm going to just use the stripe. Once you do that, come here and introduce yourself. Introduce the KY jelly by saying the same exam. Now this is KY jelly, the expired date 2028. What's going to happen once you do that? You try to put KY jelly. Okay. Once you do that, also introduce the my exam syringe is expired at 2028, of which I'm going to use the open one. Once you do that, also introduce the orange stick. And also we have the nasal gastric tube, the expired is 2025. Once you do that, use the open one, of which I've done with the introduction. Possibly, by the way, this is some say they argue to say this is the stellar, or this is not a stellar. Yeah. So if you see very much property, it involves a lot of things that you cannot even determine to say it's a stellar indeed. So once you do that, then you can go ahead with the procedure, of which you come here to say, of which should I say don't in the glass? The examination one. Measuring grams are very much small to me. go to the patient. Yes, Mr. Sonda, I'm back. Possibly, please, I'm just trying to demonstrate you're supposed to do this in 5 minutes. Yes. Mr. Sonda, I'm back. So as one thing I'm supposed to do, get the orange stick. Try to clean up the nose of the patient where you are inserting a nasal gastric tube. Then put it down the receiver there. Then once you do that, get a nasal gastric tube. Try to measure the length. And some on the soil, I'll just expose it a little bit. Okay. So from the nose tip down to the earlobe. Once you do that, probably somewhere on the sternum there. Okay? So of which this measure the length of the stomach, where of which if inserted direct the nasal gastric tube is going to die in the stomach. Once you do that, please you have to put a tight tape here. Eventually do not have a tight tape. We're going to put the strap here, and also that is to say we're supposed to reach up to here when it comes to inserting. Okay? Once you do that, you have to lubricate the nasogastric tube using the KY gel that you try to pour in. Then you come to the patient. Yes, Mr. Sonda, I'm here. So please, I would like if you can help me. If the patient is conscious, I would like if you can help me. If immediately I start to set in, please make sure that you try to swallow it, just to ease the process. Please swallow. Okay. 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 Now I want to say this is a dime. I'm just trying to demonstrate here a little bit. But if you have the patient here, I'm going to find to say since I've measured the length up to here, everything, all the tube is going to get in up to here. Once you do that, what I'm going to do here, know that there's a spigot here. And indeed, you have to determine if it is true the nasogastric tube it is in the stomach or it is in the lung. What I'm going to do, get a syringe. You come here. You try to clamp it. Then remove a spigot. So I'm going to remove a spigot here. Probably here we do not have a spigot. This one's very much difficult to remove. So they're supposed to be covered here, so-called the spigot. Then this is a syringe that I'm doing. Note that I've tried to clamp here to avoid immediately the air get in the stomach. We're going to cause some of other complications. So what I'm going to do, clamp it to avoid the air going in. So what's going to happen? Put the syringe there, then unclamp. Aspirate. So a little bit. Okay, once this tube is in the stomach, you're going to see the gastric content coming out. Before it is even reaching, just not to say this is in the what? It is in the stomach. It is greenish, yellowish like. Once you see that coming out, just not to say it is in the what? In the stomach. If it is not coming out, that means to say you are somewhere else. You have to remove it, again insert it. So not that the gastric content is coming out, that indicates to say you are in the stomach. Again, clamp it. Then remove the what? The syringe. Again put back the what? The spigot. If we have the spigot here, I'm just trying to to illustrate. In actual sense, we do not have here because it is not moving out. So do what? You put it back. Once you do that, indeed you are in the stomach. Then you can eventually start giving out the ICE. Information, communication, education. Thank you, Mr. Sonda, for your cooperation. So please do not try to tamper with this tube. And if you have any challenges, should I say, if you want to choke, sneeze, please try to inform any special choking, try to inform any assistant here, or co-as will be here very much soon. Or if the patient is unconscious, then try to inform the assistant or a bedsider. So after that, you can go ahead and say, thank you very much, Mr. Musonda, for your cooperation. I really appreciate. Then try to turn out the gloves. This is how we done out, by the way. And also the style is in the what? What I'm going to put under the receiver there. Once you do that, you accept yourself. Eventually, under exam setup, I'm going to document, or I'm going to dismantle my trolley using infection prevention principle and also document report to my ward manager. Thank you very much. That's the end of it. Should I say now the purpose of doing nasogastric tube? Number one, if the patient is unconscious, is unable to fit or unable to eat. Again, if there is mandibular workup operations, and also, for instance, if you're trying to do some tests using or try to check gastric lavage for further see if there's any infection, and also a lot of things. Yeah. Otherwise, thank you very much. See you in the next episode. Thank you.